Self-Care Toolkit.
Hi, this is Dr. Bradbury with another edition of your Self-Care Toolkit. In today's Self-Care Toolkit, we're going to talk about sleep and something that's called sleep hygiene. Sleep hygiene is a funny name for a very important thing. Know that if you have any sleep-related difficulties, that's a very important thing to try to take care of. Not getting enough sleep is something that's been shown to be really dangerous to us in a number of long-term ways as well as some short-term ways. And I know many sleep-deprived people. There are lots and lots of different things that can interfere with getting enough sleep. And so know that if you do have a specialized sleep-related problem, I strongly suggest that you get that checked out by a professional. However, you can also try any of these self-care tips related to sleep hygiene at home. These things have been demonstrated to actually really help even with a number of relatively serious sleep-related problems, including clinical insomnia. So some of these things are very commonsensical and are things that I'm sure your parents have told you at one time or another. Believe it or not, the research really does support some of those things. So, for example, know that if you go to bed at the same time, relatively speaking, every night, and you get up at about the same time every morning, you're much more likely to have restful and regulated sleep. This is one of the things that you can do that can be a simple change that can really make a huge difference. Sleep hygiene practices, such as going to bed at the same time every night and getting up at the same time every morning, have even been shown to help to reduce various symptoms of sleep-related disorders, such as sleepwalking. Know that other things that you can do that are included in the term sleep hygiene include things like not drinking alcohol or caffeine for at least a few hours before you go to bed. These things can interfere with the quality of sleep and with the sleep architecture. Similarly, if you eat right before you go to bed, this can also be interfering. Another piece of sleep hygiene advice is to only use your bed for what we call two things: sleeping and sex. Your bed isn't for anything else, and to make sure to not do things in your bed that encourage you to stay alert, like studying. If you do those things in your bed, you're actually setting your brain up to try to stay awake when you're in your bed. Other sleep hygiene skills include things like using systematic muscle relaxation or other relaxation techniques to try to get to sleep at night. If you have trouble falling asleep because you're a worrier and your anxious thoughts keep you awake, know that there's a wonderful technique that you can use to try to help yourself to fall asleep and stay asleep and get more restful sleep. And it goes like this. You want to go ahead and try to think about something that's easy enough to think about, that your brain doesn't have to work at it very hard, but that is lulling, that is something that takes enough effort and energy that you're not going to be intruded upon by a bunch of other anxious thoughts. So it may take a little bit of experimentation on your part to find just the right sort of cognitive activity to use for that purpose. One of the ones that I like to use for myself is what I call running alphabets. This is also something that's been helpful to a number of my clients who also experience anxiety sometimes when they're trying to fall asleep. Running an alphabet simply means deciding on a particular topic or a particular element that you want to name as many of those things as you can using the alphabet. So for example, you might say to yourself, I'm going to think of a list of flowers, and I want to start with A. What's a flower that begins with A? Well, Althea is a flower that begins with A. Bluebonnet is a flower that begins with B. Carnation, dandelion, edelweiss. You can see I've done this one a few times before. Know that you can get practiced at these things and they can actually become a bit too easy. And then sometimes you have to try to find a new one that'll keep your brain busy without having it spin onto something anxiety-provoking. Some people who have more mathematical minds like to use numbers. So a number of my clients like to do things like counting backwards or counting backwards by sevens. If that's not hard enough for you and doesn't keep your brain actually busy and just focused on that thing while you're falling asleep, try this one. Try counting backwards by sevens and thinking about warm brownies at the same time. You'll fall asleep. This is what will happen. Many sleep hygiene techniques are very simple and straightforward, but can make a huge difference when it comes to the quality of sleep that you'll get. I highly recommend that you try some of them. This has been another edition of Dr. Bradbury's Self-Care Toolkit.